Honorable guests, I'd like to kindly ask you to sit in an organized way to start this final session, our fourth session in the Knowledge Summit 2019, which is based on building good health and prosperous societies through knowledge, moderated by Dr. Mariam Matar, founder and chairperson of UAE Genetic Diseases Association. Joining her is Asnaksi Humaid Al Qatami, Director General, Dubai Health Authority, Dr. Hajime Ino, Director General, Bureau of Planning and Administration, NCGM, Japan, as well as John Nosta, President of Nosta Labs, and finally Dr. Azma Al-Mannai, Director, Healthcare Quality Division, Department of Health, Abu Dhabi. Kindly join us on the stage to start the final session of our day. A very good evening to you all.
It gives us a great pleasure to have you all here today with us as we are celebrating the great summit where we are discussing knowledge, the path to sustainable development. And whenever we talk about health, it is one of the core elements for any sustainable development of any human being community. And today it gives me a great honor and pleasure to have a great speaker with us here, and specifically His Excellency Hamid Al-Qatami, who again, once upon a time, not too far, in 2008, he was my mentor and my great supporter as a Minister of Health, and he gave me a great pleasure to be a first woman in the position of Public Health and Primary Health Care as Under Secretary in Ministry of Health. And with him, we tried very good, with a great support of our lovely team in Ministry of Health, to maintain a strategy for United Arab Emirates, through which we focus on infrastructures, through which we focus on maintaining a strong infrastructure for the whole development, which you will see and you saw in the past few years. So I would like to call His Excellency Hamid Al-Qatami as my mentor and my great leader to come and give us a thoughtful insight about building good health and prosperous societies through knowledge exchange in healthcare system. تفضل معاليك.
Thank you, Mariam. Bismillah ar-Rahman ar-Rahim. Dear colleagues, indeed it gives me a great pleasure to be with you today. And I'm sure that building good health is the responsibility for all of us in the society. It's not just relevant to the health institution or health department. All of us are involved in building a good health. Good health means good society and happy society. I prepare my presentation in Arabic, and I'm sure that is the organizer, they get the translator available. أنا أشكر الدكتورة مريم الحقيقة على التقديم.
I thank Dr. Mariam for her introduction. Dr. Mariam is one of the colleagues that work with all devotion with my work team. She was always keen on constant learning. She used to always tell me about her success stories and her trips to Japan in circumstances that were dire. I know about her circumstances and she knows. So I thank the organizing committee and my friend Ben Houarib for participating in this summit. I will divide this session into 4 sections. The first is health being a right of every individual, every human being. This is something undisputed. It's the human being's right to have good health and to access health care that is cost effective and with high quality in all times. As well as providing medical services and health services and no discrimination with regards to making this available, obtaining knowledge and information is very important as well. Each person, with regards to each case, medical case, they have to have all the information they require. Each culture has its own traditions and all culture. Therefore, we have to respect the variation in culture and traditions. These are the principles that that every society is based on, as well as protection of privacy. This is one of it's a rule of thumb with regards to every medical institute in the world. It's your constitutional right to have good health. Therefore, the OAE has ensured that all the patients' rights are protected, as well as their responsibilities and their obligations. And this is why the manual was published with regards to the rights and obligations of patients. The late Sheikh Zayed bin Sultan Al Nahyan stressed that health would be maintained in every aspect and that healthcare would be provided to even remote areas. Anything that came after was following his footsteps, whether it's legislations, rules, laws, regulations, even local and national entities followed this path. And this is why we have in Dubai that health insurance is obligatory, is mandatory. Therefore, the covered and insured are 99.8%. Each patient has his own right, and they have documents that does not discriminate between anyone. The health journey for each patient is mapped out, and everything is inclusive, including house visits. The health authority in Dubai has always been keen on having a prosperous and happy society. And this is always contingent upon constant knowledge. Constant knowledge as an objective led the ministry to create an innovation strategy as well as an artificial intelligence strategy. There were different efforts that have been exerted in enhancing and promoting research, and therefore partnerships were struck between different universities all around the world. We have a signed agreement with a British university tomorrow, and all year long we have such trends because we believe that continuous education is that uplifts our technical teams and medical providers with the knowledge they need. We have a whole department for data and research, as well as the Innovation Center, where research and studies have been conducted. And our colleague has been the head of this department. And we are eager that we keep in the lead of the race with regards to big data and other fields. We have to be in the forefront, especially in the medical field. And this is part of the efforts of the Smart Dubai. We believe in big data and the proliferation and seamlessness of distribution of data. These themes were not going to emerge if it weren't for the obligation and commitment between the different strategies and the alignment with the innovation strategy and Dubai Annex and the Hamdan bin Mohammed initiative for smart government. All these programs have been launched in order to be aligned, and it all is reiterating the importance of innovation and acquiring knowledge. The other theme that I want to focus on, which is focusing on care and prevention before medication. We have different preventive services that are provided to our citizens. And it's all clear and provided in all languages. We have an health annexes that is in Arabic, and another one in English that is published every Monday. And there's also in Urdu. We have different data that would be provided, and we have a lot of surveys that are being conducted, as well as different questionnaires distributed regarding diabetes and other diseases. We have partnerships with the New York University, among other universities. And while I'm coming towards you here, we are preparing a survey with regards to the healthcare in Dubai to be presented to the decision makers. Okay. Medical learning and research, as well as innovation, are an important part. How to develop the programs of residencies and increase the numbers of students, as well as the training hospitals. And these have been an incubator for different resident doctors. This slide provides us with the number of doctors and the residencies and fellowships that have been provided. This is our daily journey. The other side of it, with regards to the e-magazines or journals, we have over 16,000 journals that have been published online, and 220,000 books, as well as the exams that are provided to our students. These are part of the efforts that are provided by the Ministry of Health, the Health Authority. And we've launched two journals, two refereed medical journals, Dubai Medical Journals and Dubai Diabetic Journal. And I advise all of you to to procure these, whether specialized in the field or not, that you would subscribe, because it's great knowledge to be obtained. As for the programs and the scientific research, until now we have 205 medical research. And these numbers that are on the screen are about those who enrolled in the fellowship programs and residency programs. These are the excellent students that have been enrolled, and the residency programs and interns. You have different medical universities, and the authority has a great cadre that is holistic and integrated with regards to these programs. We see that there's an increase in the residency doctors on a yearly basis. The third aspect that I want to discuss is how do corporations benefit from a healthy society and contribute to achieving it. You have to attract these corporations that work in innovation and the information revolution. And during the last period, we managed to attract different corporations with regards to accelerators. These accelerators present their offers and we provide them with the necessary data to conduct their work. These innovations have helped us immensely in developing the health sector. For example, 3D printing. During the last period, we managed to provide different medical treatment services, like replacements of joints that were done with the 3D technology. These services have added to the efficiency of our medical teams. Artificial intelligence have been conducted through, for instance, strokes, operations and procedures have been done by robotics. As you see, this is an Emirati national. We managed to change his leg replacement through 3D printing, and he's an athlete. It did not hinder him from continuing his activities. The last theme is technology and information. Right now, we have a great amount of data and different technological devices and apparatuses. But the key is not having these equipment, but how to utilize them in changing health towards the better. I'll give you an example. For instance, improving the patient safety is very important. You have different errors. As you see on the screen, you have 8.3, where the amounts of errors committed, and it was reduced to 5.3. Before, the medical mistakes were 0.27 and now 0.05. The fatalities, since the system has been operational, it's from 0.15%, and it has decreased to 0.13. Also, admission to hospitals have been reduced from 8.3 to 6.77. So before using this data and these technologies, the ease and access to these systems and conducting the different processes has been enhanced. These technologies have enhanced the efficiency, reduced the costs, as well as pinpointing the mistake or the error constantly and working on rectifying it. These technologies, if it weren't for the knowledge that have been gained, this technology is knowledge. And we have different models, not only with regards to safety, but also the smart pharmacy and artery replacements and so on. All of these systems have contributed in reducing the time and cost effectiveness. It enhanced the cost effectiveness. We have great projects before us, and we have promising results ahead of us. Some of them are mentioned in this slide, but all of them are related to knowledge. It's all related to professional development. This professional development will not exist if we don't work on the knowledge. It's very important that we keep tabs on knowledge. We have to enhance our knowledge in order to have a healthy society and a happy society. We have to increase our knowledge and continue our education and acquiring knowledge. And this is the trend that the UAE has been following by the late Sheikh Zayed bin Sultan Al Nahyan and His Highness Sheikh Khalifa bin Zayed Al Nahyan, the President of the UAE, in addition to His Highness Sheikh Hamdan bin Mohammed bin Rashid Al Maktoum. All of them have provided their constant support to promote everything that is related to state-of-art knowledge and technologies. Thank you for your time and for listening.
وسهلا ان شاء الله. كان نسعد نحن قلنا في البدايه حقيقه ابو عبد الرحمن من هذه الصمت عمل
I'm sorry, I cannot hear the speaker.
Thank you very much, Your Excellency Hamid Al-Gitami, for a very informative and promising presentation. And as we saw from your presentation, you highlighted achievements. And that's what today we are talking about. And while you are showing us all those statistics, was clearly define how innovation and knowledge exchange improve the whole aspect of healthcare services when it comes to cost effectiveness, when it's come even to a level where we decrease the mortality and morbidity in the whole system. Thank you very much, Your Excellency, for your effort with a great support from your team. We would like to thank you on the behalf of the UAE and Dubai community. Thank you very much, Your Excellency. Yeah. I'm sure, dear colleague, while His Excellency taking us through his journey under the umbrella of Dubai Health Authority. Today, when we talk about innovation, we usually think it's there beyond the border of United Arab Emirates, and we are only receiving those innovation and we are implementing it. But clearly, we saw in his presentation, it shows how we had to modify many of those innovations to fit and at least to overcome the challenges which we have in health when it's come to the culture barrier and even in the level of happiness of our client. And as we all agree, and we had a very thorough discussion earlier, that there is no one size fit all. And that is very much applicable in the healthcare. Allow me, after His Excellency, as long as we have Dr. Esma with us, ladies first, if you don't mind. Yeah. Dr. Esma, first of all, I'm so proud to see an Emirati lady in that level, and not only going through your journey. If we will go about the impact which you've done in Emirates of Abu Dhabi with your great team, and we can see all those guidelines and the statistic which clearly define how the whole healthcare system was turned upside down in a good way. So we would like you to take us in this journey and share with us how you were able to reach this, and emphasizing on the point of innovation and how to overcome whatever challenges we thought it will be a challenge. And as I saw in many of your projects, you took it as an advantage and you built on it, specifically in Wiqaya project. Please, the floor is yours, Doctora.
Thank you, Dr. Mariam. Sorry, I'm not sure if this is working. Yeah, thank you so much, Dr. Mariam, for the introduction. And allow me to share with you the journey of a wonderful team, the journey of the Department of Health in the Emirates of Abu Dhabi, that, you know, we tried our best to achieve our target, which is healthier Abu Dhabi. So it's a journey of years, and I'll try to summarize it in a few minutes. So it's not, again, an effort of a person, one person. It's an effort of a team that walked with us through the emergence of the Department of Health since the inceptions and the creation. So we started with a small little step, small steps of creating the foundation, the frameworks, the standards, the guidelines, the mechanism. If you know, the Department of Health is only the regulator. So imagine that there is so little tools for us to implement major changes. It's about regulations, it's about, you know, setting policies as standard, but not actually having the ability to do. We need to make sure that the doers, the providers, are convinced with the let's say, with the vision, with the mission and the values to improve the healthcare in the Emirates of Abu Dhabi. And specifically, we consider ourselves the sandbox for the UAE.
You are, especially in health insurance.
Yes, definitely. So we were the first to implement the health insurance, not only in the UAE, but in the region. And with every new challenges, with every new experience, there are the advantages and disadvantages. The most important thing is the learning within that process. So now, years after, we are so much different than what we have started.
In a good way.
In a very good way. And what we thought previously is a challenge, it became right now as a source of uniqueness, as a source of a driver, of something that will enable us to take the next step. So if we want to be number one, we have to take some difficult decision with a calculated risk. It's
Absolutely.
not just to take the risk to be number one, it's just to do the appropriate calculated risk. It's okay to keep revising and reviewing your steps as a regular journey of improvement. So in a nutshell, we started with basics of regulations, PQR standards, and we inspect against standards. We implemented the JCI and the best international standard. And as we proceed, and specifically for quality, we wanted to focus on what matters to the patient. So it's not to focus on the systems, not to focus on the numbers or the KPI. It's to focus on what is the impact that we are actually doing for our patient. And throughout this journey, we created in the past 5 years what we call Abu Dhabi Healthcare Quality Index. It's based on lesson learned from 14 countries, how they improve the healthcare quality systems within their journey. And we learned from where they ended. So we took from what they have ended and created something that is customizable for our culture.
Wow.
And we tested that. We co-created. The most important thing is the co-creation.
Indeed.
So it's not something that we sit behind desks and just thinking about how to do and how to fix. We actually co-created this with the provider and with the patient, and making sure that it will fit for its purpose.
Absolutely. And Dr. Esma,
Yes.
I would like you to emphasize on the terminology of innovation
Yes.
when it's come in the whole concept of quality of health.
Of course. So innovation is an interesting term, and I'll be very honest with you. It has been abused in its concept because people consider it as an object, as a goal, while it is a tool. So innovation is a tool for you to just go above the traditional process and think of how you are going to tackle your challenge differently.
And how that was applied in the whole journey of improving the quality in Emirat Abu Dhabi.
Of course. So when we notice our result, we wanted to do something even better and more. If we want to raise the bar in terms of the outcome, we have definitely to do something differently. We have to take a different road in order to achieve a different result.
Can you give us some example, Dr. Esma?
Yes.
Here we are celebrating
Yes.
the achievement and outcome of what was there in our lovely country.
So as an example specifically, we have partnered with Hub 71, we partner with Abu Dhabi Global Market and with the different stakeholders who have the same, let's say, same objectives as us. We wanted to create an appropriate innovation ecosystem, a regulatory environment that will welcome, encourage entrepreneurships and startups to come and help us solve our problem. So we are already located there in Abu Dhabi Global Market. We have more than 35 startup companies working with us and solving the challenges that we face. Customized solution, startups coming, thinking with a fresh mind. Don't do this, let's do something totally different. And we co-create together the solution for our patient.
Thank you very much, Dr. Asma. And we are looking forward to all the progress which you are making, not only in Emirat Abu Dhabi, as well as in the rest of the region as well. And we congratulate you, Dr. Asma, for the new department where you look after the medical tourism.
Yes.
Yes. Can you, within a minute, briefly share it with our audience, please?
Of course. So the medical tourism, we started confidently walking on the steps of or entering this domain because we discovered that we have, within the findings of the result of quality, that we have something unique in terms of comparable to the region. The quality of healthcare of service providers in the Emirates of Abu Dhabi is internationally even comparable to most of the destination and sometimes even better. So that is our unique selling point.
Can you give us some example? Because I was really astonished when I attended your summit last month.
Yeah.
And to see all those numbers and statistic about international patient coming in our lovely capital, Abu Dhabi, to receive the treatment.
Yes, actually, we have wonderful, highly specialized services offered in the Emirates of Abu Dhabi. So the concept of a transplant, the concept of providing cardiothoracic surgeries, the unique burn units that is even even in the region, it's very unique. So we have very unique services applied there. While the exact number is not there, but I'm very confident to share the numbers that the number of medical tourists are exponentially increasing in the Emirates of Abu Dhabi. And that is, again, it's a collaborative effort. We have we have best providers, global providers, renowned names, offering their services for the UAE and for the region.
Whatever success will be there in our lovely capital, we are sure that it will have a great consequences on the rest of United Arab Emirates.
Absolutely.
Thank you, Dr. Asma.
Thank you.
Professor Hashimi, welcome to United Arab Emirates. You are coming all the way from planet Japan.
That's right.
Yes. So, Professor Hashimi, could you please discuss with us your thoughts about how would companies and economy in any specific part of the world will get the benefit of all those quality improvement in health system, the innovation, and even the artificial intelligence would have? What would be the impact? And is it a positive way, or we are taking the lead from them?
Thank you very much. Actually,
Can you please put it closer to you if you don't mind, Professor?
yes.
Thank you very much.
Actually, I'm working at one of the best hospital in Tokyo, regarded as one of the best.
It is one of the best.
Yeah. So usually these high-tech companies or innovative technologies usually first comes to me, the best hospital in the nation. Then applying these technologies, then it automatically trickles down to the rest of the country. That's the standard way of introducing technology. That's fine, but I would also like to suggest the alternative way. Actually,
Closer, Prof.
Sure.
Yes, thank you.
Actually, the real needs of this technology are not only in the highly advanced hospital,
Yes.
but the rural field as well. We actually need to apply cloud technology or remote technology to these rural areas that I'm going to actually present with my slide.
Yes.
And so that I think there are two ways of top-down and bottom-up,
Absolutely.
and I think we would like to harmonize these two different approaches.
Yes. And as I understood from our discussion, you have some slide you would like to share with us.
Sure.
Please, could you, the floor is all yours. Thank you very much, Professor Hashimi.
Could you please back to the first slide? Yes. Let me briefly explain about my institution, National Center for Global Health and Medicines, and why I'm here. Actually, my institution is awarded this year UAE Health Foundation Prize. And this is the reason I'm connected to these meetings. This is the appearance of my hospital, which is not something special. I mean, you can find this kind of hospital anywhere in a big city in high-income countries. But what makes our hospital different is not the appearance, but actually patient. We assure, we welcome all the patients. All means literally all, including a very privileged population, including our royal family, and also people living on welfare. Actually, about 4 or 5% of our patients are people living on welfare, and we are providing the service the same quality and same standard as the highly privileged populations. We are proud of it. So access is not an issue here in my hospital, but actually beyond the reach of my hospital, access is an issue. This is a picture that I took last week, about 2 hours drive from my hospital. This is an abandoned community cemetery. This is abandoned because this community remains only 10 people. All of these 10 people in their 80s and 90s couldn't afford to maintain their own cemetery. I feel very sorry about it. There are various reasons why this community could not sustain But one of the major reasons is difficulty in accessing healthcare. Because of not having an access to healthcare, they have no choice but to abandon their community and abandon their cemetery, which have more than 500 histories. Just a few months ago, the mayor of this community came to me and asked me, please help. I went there last week, I saw this abandoned cemetery, and I decided to help. This is a rough blueprint of how to help these communities. I actually discussing with my colleagues, storing all the health data in a cloud, sharing it with all the health professionals supporting this community, physicians, pharmacists, and the nurses, and providing a remote health care. Actually, the technology using to this plan is nothing very new. It's an existing technology. But the issue is not to invent a new technology, but how to apply or how to implement the existing technology that we have to these remote communities. This is one of the missing link that we are trying to fill in. This is a typical Japanese traditional village that I'm proud of, which is contrary to today's Dubai. But I have a dream of one day when I retire, I would escape from Tokyo and returning to my home village like this, having a peaceful life. It's a west part, Tottori, you may know. But to do that, there is a challenge. My hometown does not have a doctor except me, and does not have a hospital. So for me to realize my dream of returning to my hometown village like this, we actually need to apply our new technology, not only to my own hospital, which is the best in Japan, but also these situations. So technology is not only for highly advanced communities, but the real need is here, and we have a certain missing link. 5 more minutes. I think this is fine for us to offer that 5 minutes to John. I think John has a lot to speak.
No, no problem. You can continue. You finish your slides.
Yeah. This is the first part of my talk.
Oh, thank you very much.
Thank you very much for your attention.
So now we're coming to a person who is very well known in the social media, Dr. John. Again, we go back to innovation. We go back to healthcare. And with you, we would like to emphasize on the point of implementation. We hear a lot about all those new innovation, how they will change the whole concept of cost effectiveness, improve the quality of life, offer new job opportunity for young nation who's very well in technology. But again, how do you see the whole definition of implementation in reality?
Well, Your Excellency, thank you for your opening comments. What a wonderful panel I have here. I think that it comes down to two words that have already been mentioned here today. And the words are knowledge and power. And I want to start a little bit about how interesting that this is a knowledge summit. I could imagine some of the other names that were thought of. The Innovation Summit, the Transformation Summit, whatever. There's many. The Disruptors Summit, but it's about knowledge, because I think that we live now in a cognitive era.
Absolutely.
That as we move away from the traditional industrial revolution, where it was powered by our physical strength, the world today is powered by our intellectual prowess. That's why I think that the Knowledge Summit is so fundamental to the transformation of humanity. It precedes innovation in a very interesting way. And if you dig a little bit deeper on that, you could even begin to explore the idea that it's been said that as we think, so we act. And as we act, so we become. So the essence of the transformation that we're talking about today begins with the way we think. And I think that is so fundamental about the world today, that it is such a cognitive construct. Now, what is the adjacency to the cognitive construct? Artificial intelligence.
Yes.
And that's the other side of what I wanted to say. Knowledge and power. Artificial intelligence represents a tremendous power, a disruptive power, an innovative power. But let's take a step back. What was humanity's first technology? Anybody know?
Fire.
Fire, exactly. Fire was our first technology. It allowed us to move from cave to cave. It allowed us to get warm. It allowed us to eat protein that grew our brains. But what happened with fire? Today, one of the leading causes of personal and property destruction in the world is what?
Fire.
Fire. Well, isn't that interesting? That we have a strange duality between fire that could kill us, that could destroy our house, and fire that cooks our dinner and keeps us warm.
Absolutely.
And we are seeing that exact dynamic play out here and now. That it's the power of knowledge, wisdom, and innovation.
Yes.
It's the power of knowledge, wisdom, and innovation that will scare us, that will frighten us. And that duality is so interesting. So we are at an inflection point in human history.
Absolutely.
I don't think that the nature of innovation is such that it's about an adoption sequence.
Yeah, again, John, but when we talk about Nostalab, and if we will go through your journey and your career development, I
Okay.
can see you are, I cannot say multitask, but you are with lots of ability and skills, which I'm sure you develop it gradually. And now we can see that there is at least a solid thought whenever you discuss any point.
Well, my parents were very angry at me because I decided not to become a doctor. And I wanted to pursue other areas. My background is in cardiovascular physiology. I worked at the Brigham and Women's Hospital in Boston, which is a large medical center at Harvard Medical School. But for me, it was less about the idea than it was the implementation of the idea. Because in today's world, innovators have a slogan. You know what that slogan is? Build it and they will come.
Yeah.
I'm going to say it again. Build it and they will come. It's wrong. It's the ability to diffuse the innovation into a system. It's the ability to get citizens to adopt a behavior. It's the ability to get physicians to adopt practices, and that's what I focus on because it's so critical to
Absolutely.
driving innovation.
So, John, can you please briefly share with us about Nostalab? What is it, and why it is so important for all those people who are investing a huge amount of money? They want to know more about your lab.
Nostal Lab is a think tank. It's a think tank built on the Hollywood model. Now, that's a word that we probably haven't mentioned here today. The Hollywood model? It's not about celebrity. It's about bringing the best and the brightest from around the world together to help think through a problem. So it's not a staff of 500. It's a staff of me who brings in the best thinkers from Google, from Harvard, from MIT, from down the road if it's a local.
From United Arab Emirates.
Absolutely, without a doubt. So that's what Nostal Lab
Next
does.
time you need to invite Dr. Isma to come on
Absolutely,
board.
I would love to.
Yes.
I would love to.
So when we talk about Nostalab, we can hear that we can go back and see there is two similar initiatives. So what makes Nostalab different? Why it is very well rated? Why people talk more about it?
I think it's because we focus on that fundamental level. Elon Musk talks about first principles.
Yes.
And I'm going to go back to the word I see on all the walls. It's about knowledge. It's about a cognitive advantage. And the cognitive advantage about being smart, about understanding the nuances of 1,6-fructose diphosphate,
Yes.
or aspects of clinical care, or the nature of innovation. But it's also about another network. And this is why I love coming to places like Dubai, like the UAE, because that is defined here, and that is collaboration. We live in a collaboratory. Sometimes I
Absolutely.
refer to NOS Lab as a collaboratory, a laboratory of collaboration, because in today's world, the most important competitive advantage that we have is collaboration.
Collaboration.
Very different mindset
yes.
from perhaps 5 or 10 years ago, where it's much more one of exclusivity and
Yes.
proprietary behavior.
So, John, can you share with us some of the outcome of your lab? Is there anything implemented in reality from those thoughts, from those high-level discussion and thinking?
The outcome is simple. We build ideas that stick to the roof of your customer's brain.
For example,
Changing the word osteoporosis to bone health.
elaborate, please.
If someone comes to me and asks about osteoporosis, I look away because I am in denial of my aging, of my years. I say, no, I don't want to worry about osteoporosis. That's a disease, that's a condition of my grandmother.
Yes.
And I turn off. The diffusion process, the diffusion of innovation, the adoption sequence is stopped. But if we can communicate more appropriately by saying bone health,
Yes.
it's something that's more resonant to me as a runner.
Absolutely. Yeah.
So those are some linguistic analogies that of what we've done.
Yeah. Dr. Esma, going back to you, and when we talk about United Arab Emirates, I'm very biased to my lovely country. And when we talk about health insurance, and we know that health is a right for any human being, and any individual should have the right to receive a need in emergency status. So how do you think the concept of health insurance maintain that safety net around people who is helping us to develop our country? And in the same time, we are telling them, thank you very much, in a different way, where we make sure whenever they need that specific type of health, it is there, available, accessible, and affordable.
I believe, I'm not a health economist, but in our discussion and a lot of discussion we do in terms of the health insurance and the comparability across the world, I believe in the UAE, we have cracked the code, let's say.
Yes.
We have managed to find the solution for equitable healthcare access, specifically when through the implementation of the insurance law in Abu Dhabi in 2005, everyone will get an access to the healthcare, especially in the terms of an emergency.
Yes.
So the foundation of the creation of the health insurance system mandate that everyone that is resident or living in the borders of Abu Dhabi should be insured, whether through, if they are a UN national, this is through the government, and if it is a non-UN national, and they are through the employers.
I see.
So that is a full requirement for insurance coverage. Even more to that, still, if there is, let's say, a visitor coming to the UAE and God forbid, is having an emergency, within even that foundation, within their tickets already, there is
Yeah.
an insurance coverage for emergencies.
I see.
So you can consider that it is 100% coverage in terms of the accessibility of healthcare.
And could you elaborate more about, again, John spoke about partnership.
Yes.
And how we were able to achieve that when we talk about private-public partnership, how that was implemented. Again, implementation of innovation, of knowledge.
Of course. So specifically defining roles and responsibility.
Yes.
So specifically defining roles and responsibilities. So the healthcare system model in Abu Dhabi defines that there are the regulator, which is compromised from the Department of Health, and the provider, whether it is a government-owned or a private sector. And through that, it's a universal regulation. Let's say we don't differentiate that this is a government provider and this is a private provider. It's a plain level field where everyone is accountable and
Absolutely.
responsible to achieve the required regulation and achieve the best outcome for healthcare.
Yes.
But if we are going to talk about the broader global challenges
Yes.
in terms of the universal healthcare access. So again, going back, Abu Dhabi can be considered the sandbox, an area where such model and such knowledge can be shared across. So I just came back from Cape Town from attending the ESQA conference, and the
What
people.
is ESQA conference?
ESQA, it's the International Society for Equality.
Okay.
And from all over the world, we talk about the best healthcare systems and the true challenges of the patient.
And
So
do you think there is a best healthcare system?
actually,
As a definition, do you agree with that?
we strive. It is a goal.
Yes.
We strive and we compete and we try our best to achieve the best.
Yes.
However, quality
Absolutely.
is a moving target. If you ask me this question, perhaps maybe 10 years back, I'll tell you whoever got the JCI accreditation is the best. Today, no,
Yes.
that's not the case.
So while you are talking, Dr. Esma, John is nodding his head. Would you like to,
Sure, let
to
me
have
jump
your
in.
input in that?
We live in a participatory world today. And the nature of that is that we are seeing a shift in clinical practice and healthcare. And that shift is one from control to collaboration. 10 years ago, 10 short years ago, when I went to the doctor, he gave me a pill. Today, I go to the doctor and she, more than half of medical students are women now, she discusses the nature of my care and develops a plan with me. So I think that that's so fundamental that we see the ability of people to have access to care, but also the other side of that equation is looking back to the very famous G word in the world today, and that's, the first one is Gutenberg.
Yeah.
The ability to disseminate data so that
Yes.
people could make decisions, and the other G word today is obviously Google.
Google.
But I think that the availability of information and the empowerment to
I
collaborate
see.
in clinical practice is extraordinarily important. One other point is that I get in trouble for saying this, but I'll say it anyway. I think that the collective intelligence of patients is smarter than the doctor.
They are getting smarter.
the collective
With a smartphone, by the way.
Well, parents with children with rare diseases or chronic illness know
Absolutely.
more about the clinical trials.
Indeed.
They know more about their kids' blood work and labs and everything, that they bring this colossal amount of information. It's
Absolutely.
the engagement of people like that into the clinical collective that will change things.
And John, while you are talking about rare disease, only for the audience and for my respected colleague here, United Arab Emirates, it's the only representative in the Global Commission for Rare Disease. And that itself indicates how open we are in this part of the world. So we are representing the whole Arab world when we talk about rare diseases. And that again was built on exchange of knowledge and experience from people who decided to come and help us in developing our country. So they came with their children who's having rare disease. But again, they help us to set this need through which we had to be part of a global decision. So going back to you, Dr. Hashimi, when we talk about knowledge, innovation again, I'll go back to the terminology of implementation. Here where we struggle as a decision maker, as a physician, as a pharmacist, as a nurse. And we believe that nurses are a category of healthcare team which are underrepresentative in majority of healthcare discussion. But when it comes to innovation and when it comes to technology and implementation, we see the nurses, they are in the front line. How and where are they when we talk about Planet Japan?
Actually,
Can you
Nurses.
make it more close?
Sure.
Thank you.
Actually, nurses are the biggest chunk
Indeed.
of the healthcare providers. They are the one actually treating patients. They are the one who is actually meeting the patient most. So nowadays there is a certain transformation of the care. I mean, it's not just instructed, provided by a physician, but actually taken care by nurses, and this is increasingly important with an aging populations.
Absolutely.
We need more and more hand rather than paper on prescriptions. And this transformation actually happens not only in the hospital, but in the home care settings.
Absolutely. Can you elaborate more about the health system in Japan, where we can see there is quite good number of seniors there, and how with the whole concept of innovation and providing a healthcare through nurses, through home services, was very effective. Can you share with us?
Yes. One of the key elements that we made change is the payment changes.
Yes.
Before, traditionally, payment only happens whenever physicians do something.
Yes.
Physicians do prescriptions, physicians do surgery, then the payment happens.
Yeah.
And a smaller share, the lion shares, the smaller share of this payment trickle down to other healthcare providers. Now we actually transform this system. So payment actually now is made for direct service of the nurses. So nurses are directly paid
I
rather
see.
than passing through physicians. This actually transforms whole the system, whole the concept, and the notion of the patients.
And we know that Japan is very well developed when it's come to artificial intelligence. And I saw this myself in the healthcare system when we talk about healthcare services. Can you please share with us the artificial intelligence impact on providing such services when there is a short of hand?
That's right. Actually, artificial intelligence is an evolving area.
Yes.
And with this, the evolution, there is still a certain resilience or reservation among a conventional the way of work, especially from physicians. Physicians want to decide all by himself or herself without any intervention from this something new.
Yeah.
But gradually the artificial intelligence is utilized for certain diagnostics, especially the visual diagnostics, reading X-rays or reading CT scans and
Absolutely.
so on.
Yes.
These and also pathological analysis. This visual area is the first area that we are actually introducing this artificial intelligence, and it's going on.
Yeah. So when we talk, John, again going back to some of the point which we highlighted in our talk earlier, when we come to the impact of technology, knowledge sharing, and improving the quality of health. So when we talk about innovation in your lab, or we talk about whatever new aspect Japan is getting in providing care for seniors, or when we talk about improving the quality and have some clear point where we can define a good performing healthcare services or not. So how we can summarize the whole impact of such approach and technology and innovation when it's come to quality of the health of an individual, because the definition of such terminology, it might be completely different from the patient aspect.
That's true. I think that when we look at the quality of health, what does that mean?
What
the
does it
quality
mean?
of health.
Yes.
You know, I think that in part, and I'm going to get to your question in a second, it's life extension and life expansion. It's actually an X and a Y axis, because as we get older, unless we have a level of productivity, what good is it?
Yeah.
So I think it's an X and Y axis dynamic. Number one, life extension, life expansion. But let's add, because we're in Dubai, let's add another Z axis, and that Z axis is happiness. And that intrinsic ability to be happy creates that. Now, it's all very ethereal. If I said I want my company to be 20% more innovative.
Yeah.
And we hear this all the time.
Yes.
Heads of state say we need-
KPIs.
Yes, the eyes. And that's nonsensical. Do I need to make my copy machine 20% faster? No. I need to use the judicious selection of points of change. The Harvard professor Stephen Jay Gould talked about evolution in the context of punctuated equilibrium.
Of punctuated.
Punctuated equilibrium.
Yes.
Nothing happens, nothing happens, nothing happens. Then an asteroid hits the Earth and the dinosaurs die. Well, then things happened. Ice age. And so that's what innovation is. To me, innovation is not a smooth curve. We talk about exponential change, and we always show those beautiful smooth curves. They're not smooth, they're bumpy. But it's our challenge to think of innovation as a strategic plan.
Absolutely.
For example, if I'm a pharmaceutical manufacturer or a drug company, maybe the point for me is to find the right patients for a clinical trial.
Absolutely.
So patient recruitment might be the most important part of that. The other methodologies are largely in place. So innovation to me is a strategic plan. It's a knowledge-based dynamic. And too often we just kind of say, oh, be more innovative.
Absolutely.
And that's dangerous.
Now, with a better understanding about how ethnicity play a big role in how we respond to medication is not anymore the definition of my disease. And having this better understanding, again, we didn't reach it unless we had some innovation to set the whole approach of clinical trials in different way. Now, majority of pharmaceutical companies, they are recalling all those, let's say, failed clinical trials and trying to be more specific in recruiting patients. For example, here in United Arab Emirates and in Dubai, especially in my field as a genetist,
Yes.
we are facing a huge criticism because I don't recommend any of those genetic investigation to be applied as a law, simply because majority of them, they didn't have enough Emirati or some people from the Middle East to be part of their first trial where they were looking for those mutations. And it was again that clear in the point which you mentioned just now, John, when we talk about patient recruitment. We know now a blood pressure patient, I cannot prescribe for him beta blocker, calcium channel blocker, unless I know his ethnicity. If he is African, I need to provide him calcium channel blocker.
Right.
If he is Caucasian, I'll go for beta blocker. So when we talk about this innovation, Dr. Hashimi, how that is applicable in a community in Japan, which is defined as a majority being Japanese.
Actually, we
Can you make it close to you,
Sure,
please,
sure.
Doctor? Thank you very much.
Actually, we are monotonous ethnic groups.
Yes.
90-something% of whole of population is traditional Japanese in the same ethnic groups. And this actually having a challenge in introducing a medicine from outside.
Absolutely.
The pharmaceutical companies based in US, Europe, are actually creating this medicine based on clinical trial on their own ethnic groups,
Yes.
not necessarily the same as our own groups. That might affect differently in actual the medications.
Yes.
So actually our pharmaceutical regulatory body is very concerned about these ethnic issues
Yes.
and requiring what we call bridging study
Yes.
to actually adjust the interpretation of this clinical trial.
And what about the innovation and the artificial intelligence? Did it play any role in minimizing such a challenge?
That's what we are actually exploring.
Yes.
How to actually modeling
Absolutely.
of the different the effect
Yes.
between different ethnic groups.
Yes.
This is one of the areas where the artificial intelligence could coming in.
Yes. His Excellency Hamid Al-Gatami, he shared with us the progress which we are doing when we talk about how we were able to make the technology helping us to improve the happiness in our clients, if it come as a trainee, as a physician, or as a patient. And we saw that as a number. And when we recall the population of UAE and Dubai specifically, they are more than 195 are here. And to reach that level, where people are satisfied to 99.8%, I believe that is another achievement, and where we need to address. And here where documentation come to. So what is the role of documentation of any success or a failure would have in improving the quality? Asma, would you like to add?
Absolutely. And I mean, specifically documentation is just making sure that the knowledge is preserved for the generation to come. And I would like to touch base on the important point that you have mentioned about the genetic composition and the diversity of population. As you know, now the future of healthcare is moving toward more personalized and precision medicine. And that is what we need to talk about. In the beginning, you have mentioned a very important point, which is there is no one size fits all. So if we are going to think about healthcare, and with the more advancement of the patient know better. And I know a story about a mother of a patient with a rare disease, that there was absolutely no cure. There is nothing for this patient to do except for the mother to watch her child die as the time proceeds. But with that will and with that requirement, she investigated and used Dr. Google to figure out there is a certain clinical trial at a certain country being done for such disease. And she fought for her child, and she got in.
God bless her.
And the child right now, who was supposed to die in a few months, is an 11-year-old healthy child going to school.
Alhamdulillah Rabbil Alameen.
Alhamdulillah. So that goes to the
Absolutely.
point about, you know, the empowerment of the patient voice,
Excellent.
personalized, precision, moving toward. Now it's not about getting the pill, it's about changing and editing the gene
Absolutely.
that is causing the problem.
Absolutely. So in the last 5 minutes of our talk, I would like to give the audience chance for any question for my respected colleague. Please. Can we have the mic, please? I would like you to introduce yourself and from where you are, please, especially professional-wise, so my audience will...
My name is Muhammad Al-Bader Usman. I'm a doctor, physician, intensivist in Rashid Hospital. So my testimony will be heard being working in DHA under His Excellency. And really, many times we have been faced with him suddenly, with unplanned meeting in front of us in ICU. He's usually coming and seeing what's going on. That made us feeling that we are doing a great job, and it built a big and strong bonds between us and between the patients, which reflected in their trust. I have only one question. So we are living in Dubai. Yes, we are living in Dubai with a diversity, with more than 200 nationalities, if I'm not wrong. Can we get benefit of this diversity to make a very big globalized center for research regarding diseases, regarding its behavior with such big diversity of nationalities?
So
I think it will be very...
So, Doctor, is this question for His Excellency or for whom? Because you are talking about Dubai.
Yes, actually, the first part was like a comment, and this is just a suggestion. So because I picked up your words about diversity of the nationalities.
Yes. So, Doctor, if you allow me, I'll answer on the behalf of His Excellency as per the presentation.
Yes.
As you see in Dubai, we have a very big project talking about Dubai genome. And in this project itself, we believe that it is a great opportunity for us in United Arab Emirates and in Dubai to allow those 200 nationalities to be part of our research and our project. And we believe that Dubai will give back to the whole globe a whole new information about their own citizen who's living somewhere else, not in their country. بعد إذنك طويل العمر جاوبت. Yes, تفضل.
Thank you very much.
دكتور عرف بنفسك أستاذي
I am
العزيز.
Azam Kayase. I'm gastroenterologist and now working on microbiome medicine. I am in Dubai since 40 years. As I discussed before with both of you about microbiome medicine. Now, as Dr. Mariam said and my colleague said, we should start to know exactly what is going on in our society and even in universe. We'll start by microbiome.
Absolutely.
Did you feel microbiome? It will be, of course, it is the future of medicine. Did you feel it's easy to start now, or still there is long time to reach to this one?
Would you like to answer Professor Hashimi?
Start now. Of
Start
course,
now.
the sooner the better, yes.
Not yesterday?
Not yesterday.
Yes.
Or, it should have started yesterday.
Okay,
Yes.
if we want to start now, that's meaning this is with His Highness here. That's meaning we can start with you together to make new microbiome signature in Dubai and outside Dubai.
Inshallah, this is a promising project, and we're sure His Excellency will have a discussion with his team, and I'm sure they are looking at it.
I hope so.
Dr. Qiyas,
I hope
inshallah.
so.
Inshallah.
Thank you.
Any other question you'd like to answer?
Thank you very much.
Welcome.
Dr. I'm Wadad Abul Khudud. I'm actually a microbiologist and immunologist from American University of Beirut Medical School. I would like to thank you all for this amazing summit. And as a resident in Dubai since 8 years, I can tell you that I'm witnessing the innovation, specifically in healthcare. And on the other side, my question is for you, Dr. Mariam, regarding genetics and oncology. Where are we there? Since we were studying that in the books, I can see that we are more interested in educational research on oncology and genome.
Yes.
So where are we in Dubai on that?
What I can share with you, again, I'm talking on the level of United Arab Emirates, and through a research center called Sheikh Zayed Research Center, we started back in 2014 with another GCC country to do a genetic screening for 49 female from the GCC country who had a high family risk of breast cancer, and either they were a survivor. So when and they were BRCA1 and BRCA2 negative. So we decided to do a whole genome sequencing for them. So when we did this whole genome sequencing, we are talking back 2014, we came to a conclusion which had a great impact, not only in UAE, as well globally. We were able to identify 21 new mutation, which is specific for the ethnicity in this region. And it was published in 11 peer-reviewed journals. And right now, anybody who is having a breast cancer, they will be screened for BRCA1, BRCA2, and 21 new mutation, which we were able to identify with this collaboration with other GCC country. So as a United Arab Emirates, we are a beginner, but we are trying at least to be so advanced and selective in a low-hanging fruit where we can contribute effectively to the whole global concept of genetics and as well as epigenetics. The lovely part of it as well, we have our colleagues in Khalifa University and in New York University. They are working on a lovely project where they are studying 3 generations of United Arab Emirates who is carrying a mutation of diabetes type 2. The grandparents, they don't have the illnesses, they have the mutation. The mother, she's having diabetes, the father doesn't. And 5 of their children, 2 of them, they have diabetes type 2. So now we are studying the epigenetic factor. And we are thinking that the most effective and powerful environmental factor was sleep. Lack of sleep in the new generation, it switched on all those nasty genes. It's exactly like this auditorium. When the contractor came and he built it, he built the ceiling, the spotlight, he extended the light, but imagine there is a switch of light through which you can control which spotlight. And exactly we as a human being, we are born with our DNA, but along with those DNA, we have these switches, because of which you can see a female, she will get her puberty in a specific age, we get our menopause in a specific age. It's all because of these switches. So in United Arab Emirates, we are trying to be further advanced to take a role in epigenetic and try to address the impact of sleep, lack of sleep, and switching all those diabetes, type 2, hypertension, familial hypercholesteremia, as well as obesity. And we think we are there. Again, we are not doing it alone. We are doing it with a global center. So as a UAE, we cannot take a credit for all those initiatives, but we are trying, again, to do a further collaboration where we will be involving in the innovation, not only receiving it.
Anyway, I'm sure you'll always be the leaders, and I think it's on the strategy for the DHA innovation when it comes to oncology prevention and treatment.
Sure.
And thank you very much for all of your efforts.
Welcome. Thank you very much. Is there any further question? I would like in the end thank all my... There is a question? Yes, please. Can you introduce yourself, please?
السلام عليكم.
عليكم السلام ورحمة الله.
سأتحدث باللغة العربية.
I will speak in Arabic. My name is Ali Hamad. With regards to health, health is one of the sustainable development goals, and there is a major development in the UAE and some European countries. Such as Germany, as well as Singapore, Finland. There is a major development in health or improvement, but over the fees are an issue in these countries. Health insurance. The fees of health insurance, for example, in the UAE are high, and in some cases over there, they reach 12,000 dirhams. This, of course, it wasn't an enhanced card. It could reach even more. That's in Abu Dhabi. It's approximately 12,000 dirhams. Other cases for those over 50, over 60. So your question? I haven't finished my introduction yet. There are also other cases, such as the sons of local women or local females. They pay these amounts. So with parents, I mean mothers Emiratis and fathers non-Emiratis, so dozens of families go to these centers. So there are goals from the GCC is that health include or should include everyone, and a local or a national should be treated similar, or any GCC local should be treated as if he was in his own country. So if I go to Oman, I should not pay. And the hospitals or public hospitals of Oman, I should not pay. But Omani, if he comes to the UAE, they will ask him for his residency, where do you work, a certificate or degree, and he's excluded. This does not include emergencies. We want a recommendation by the summit to more facilitations for better health, more facilitations for better health, and facilitations for the GCC nationals or citizens. We'll make sure that the organizers will take this remark into consideration. Dr. Asma, would you like to add anything? We and the UAE to follow the policies and federal policies and laws, which include as treating the GCC as a local, and this is applied in the UAE, in all Emirates of the UAE. And if there's any single or individual case, then we can review it. Thank you very much. Thank you very much. In the end, I would like to expand
all of you, and it was a very fruitful meeting. Thank you for exchanging the knowledge, and it's an honor to be here among all of you. Thank you very much. Thank you.
Thank you very much. Shukran. Thank you.